Hi, I'd like to reintroduce Dr. Richard Libman. He is a friend of ours from the Stroke of Luck program and has been on with our telethons. He's always a wealth of information, good news, and what's coming up. And he's got a couple of things to wrap up for us now. Dr. Libman is the Chief of Vascular Neurology at Northwell and a professor of neurology at Zucker School of Medicine, which is Hofstra and Northwell. So Dr. Libman, just a couple of quick things about some other treatment. I think there's some new rehab that you have a little bit of information about.
Okay, and thank you very much, Ginny, and hello everyone again. Um, from the rehab standpoint, I'm just going to keep it very brief and tell you about something that's kind of hot off the presses. And again, to give you a little background, rehab for stroke has been kind of a tough nut to crack, you might say. We have all the new innovations like clot-busting drugs that we've talked about in other segments, TPA, the newer form of TPA, tenecteplase, that we're maybe starting to use just over the horizon to perhaps slightly further improve the outcome of patients when treated very early. We may talk about in a different segment some of the more aggressive treatments we have for stroke, such as, for example, a catheter going right up into the brain and mechanically pulling out blood clots, which has revolutionized the treatment of these huge, devastating strokes and allowed patients to recover sometimes fully from what otherwise would have been just devastating, horrendous problems after stroke. And that's a whole other kettle of fish that we could talk about at another time, but a new, more aggressive, relatively new, more aggressive treatment for stroke. That's where all of the progress has been for the most part. When it comes to recovery, meaning long-term recovery after stroke, you know, we've been stuck for many years. Many years ago, it was taught that you make some recovery after stroke, you improve for about 3 months or so, and after that you kind of plateau and not much happens. And that's kind of a depressing thought, and fortunately it turns out to be wrong. And it's well shown that people can improve even years after a stroke, even years. But of course, recovery is very slow and sometimes painfully slow in the years following a stroke, though it can still happen. But what's been shown in some studies talking about rehab is that if you do very, very aggressive, very strenuous physical therapy, even years after a stroke, you can improve function. Meaning you can go from being, say, very weak in an arm and a hand to being able to move that arm and a hand again and get function out of it. And I'm talking about just, for example, 4 years after a stroke. I think the studies went up to 6 years after a stroke, even longer, with very aggressive rehab. Now, does that mean you always have to be with a physical therapist? I mean, it was something like 6 hours a day of physical therapy, 6 days a week for something like 6 weeks. I mean, who does that? It's almost impossible, but that's the way they sort of did the research and all that. At least you could show that with really hard work, you could make progress years after a stroke. Now, not everyone's going to go to a physical therapist. There's very little doubt that people on their own, if you work at it, even years after a stroke, you can continue to improve. And that goes for both something like muscle function that can come back years after a stroke as you continue to use that muscle, and that arm or that leg. That means not always compensating. Let's say you have a weak right side. Occupational therapy teaches you to compensate. You can use your left side. That's fine. Nothing wrong with that. But this newer, more aggressive form of physical therapy will say to you, no, don't use your good side to compensate anymore. Put it behind you, tie it behind your back if you have to, restrain it. And that forces you to use your weak side. And lo and behold, the more you use it, the more function can return when you focus on it and concentrate on it and force yourself to use that weak limb. As an example, you can show improvement even years after a stroke. Now, That's one newer form of so-called physiotherapy or physical therapy that has come around and has been proven in the last few years. The same holds for speech therapy. Just to give you another example, exactly the same thing. If you force yourself to speak after you've developed, for example, some kind of aphasia after a stroke, and you are having trouble producing speech, just as an example, forcing yourself day after day, month after month, year after year after a stroke, the same type of research has shown that language function and speech can also improve years after a stroke. So that's the good news in terms of physical therapy and speech therapy. Nobody should ever give up, even if it's been years after your stroke. Do not become kind of negative or nihilistic and say, well, nothing's going to happen. I'm not going to improve. My doctor told me that once 10 years ago, whatever it is. Don't believe it. It's not true, but it does require some input from you. It's not just sitting back and hoping that something's going to change. It requires effort and requires work. And if you put that effort in, then there is likely to be a tangible result for both motor function, meaning strength of a limb, and language or speech, for example, after aphasia, so common after a stroke. And I did want to mention what's hot off the presses in terms of recovery after stroke is there's a nerve that comes out of the brain or goes into the brain from way down below, goes up into the brain. It's called the vagus nerve, and it has other functions in the body. It so happens that if you can electrically stimulate that nerve, then those electrical messages go up back into the brain. And when you couple that or pair that with standard physical therapy, you can show a lot more improvement after a stroke than you would normally see after physical therapy alone. And so that's something, it's a little bit invasive because it does require a little device. As you've seen, you could think of a pacemaker that you put in. It's a little bit invasive. I mean, there's a little device in there with a battery and that sort of thing. So it's not like major surgery, nowhere near that. But if you think of something like a pacemaker, same general idea, a little electrical stimulator under the skin, and you can stimulate the nerve. And it's been shown to improve recovery after stroke. It's been tested. It's not a fly-by-night. It's not one of these con artist type of things. It's not wishful thinking. It's not something that you get from the local snake oil salesman. It's been tested carefully, and just weeks ago was approved by the FDA. In other words, they looked at the research. And the FDA, they don't just approve something willy-nilly. It's not that easy. It has to be scrutinized and be shown to be safe, be shown to be effective. And this electrical stimulation device, tested over the last few years and just recently approved, is the latest addition to our armamentarium that seems to show, that does show, and has been proven to provide greater improvement after stroke in the long run. And again, I mentioned this because in the other segments that we talk about TPA, the clot-busting drug, tenecteplase, we may talk a little bit, and I just referenced or alluded to the more aggressive techniques of catheter-based treatment, putting a catheter through the groin, going up into the brain, finding a major blockage, and literally pulling it out. Sometimes with a device that pulls it out, sometimes with a suction device that kind of sucks it out, but you can get that clot out, and that can go up to 24 hours after stroke onset. So many resources have been put into these early treatments, and they're remarkably effective, but they are aggressive. And you want to do it on as many people as you possibly can, but you can't treat everybody that way. Not everybody comes in on time, even with a 24-hour window. Not everybody's eligible. Not everybody gets better, even though a lot of people get better. So then we also look at the other side of the coin, which is what we're talking about, the rehab side, physical therapy, speech therapy. Can we help people get better soon after a stroke and even years after a stroke? That's the silver lining. Whereas people used to be so pessimistic. What do you do 6 years later? Throw your hands up in the air and just, sit around feeling despondent and depressed? So common after stroke, depression. Do you give up? And my response would be absolutely not, because we have made these major strides, not just in the acute, meaning immediate treatment of stroke, as we've talked about in this and other segments, but now also on the rehab side. And there's more to come. There's bound to be more to come. And I'll just mention as a segue, when it comes to recovery after a stroke, aside from things like the electrical stimulation, vagus nerve stimulation that I mentioned, everybody wants to know about, guess what? Stem cells. Can stem cells help recovery? Well, they're pushed for all kinds of diseases. Now, look, stem cells are still at an experimental stage for many diseases. There are some people who are pushing stem cells for the treatment of all kinds of diseases. And I just urge a lot of caution, because there are a lot of people out there who are not necessarily serious doctors or scientists who have ulterior motives for pushing stem cells. And they may not be doing it with the most honorable of intentions other than making a lot of money. So I would ask you, be very, very careful when you're walking into some stem cell clinic, maybe in Florida, that says they can cure you of your heart failure, or they can cure you of your Lou Gehrig's disease, or they can cure you of Alzheimer's disease. Please be very careful, because there are a lot of charlatans out there, and there are a lot of safety questions, aside from effectiveness questions, a lot of safety questions about those types of treatments when they're being done in some of these so-called, I have to put it in quotation marks, stem cell clinics. Be careful. But that doesn't mean we throw out the baby with the bathwater, because there are a lot of very serious scientists and doctors who are doing very careful, very scrutinized, very careful research looking at stem cells after stroke. And that means sometimes a little bit of invasive treatment, like injecting stem cells right into the brain. And it can be done through small injections. I'm not talking about making big holes in the head or taking off taking off large amounts of the skull or anything. Not that gruesome at all. Often these little tiny little holes to inject stem cells into certain areas of the brain, as an example. And there is some early research already, not just in animals, but in people, suggesting possible benefit. But that's early research. And the proper studies are ongoing, not just being planned, but ongoing, looking at stem cells after stroke, which could be years after stroke, trying to see whether that can help the brain recuperate, regenerate, you might even say, form new connections after a stroke, which is like the holy grail. It's not just trying to prevent a stroke. It's not just trying to treat a stroke and restore the blood flow as quickly as you can, clot busting drugs, catheters, pulling out blood clots, but it's actually helping the brain to regenerate. Again, you might call it the holy grail, but it's not science fiction. But the research has to be done correctly, which unfortunately means it has to go slowly. It has to be done safely. It has to be done on the right patients, and it has to be done very, very carefully, so that we are careful to try to help patients get evidence that this is a new helpful treatment and that is safe, because side effects you know about, side effects you never know about until they pop up. You have to be extremely careful. The last thing you want to do is hurt anybody when you're doing experiments with new forms of treatment. But I did want to mention it because these are some treatments already being used, some treatments recently approved, like vagal nerve stimulation, and then some treatments like stem cells still being researched, but inspiring hope in all of us who are interested in stroke treatment and recovery. And the bottom line is, I think that we've taken a disease called stroke, which a mere 25 to 30 years ago was essentially untreatable. For those of you who've been around for at least 25 years, and I know there are probably younger people in the audience and older people, if you think back, stroke was not necessarily a death sentence 30 years ago, 40 years ago, 50 years ago, a little over 25 years ago, not necessarily a death sentence. No, you didn't necessarily die of the stroke. Some people did, but it was among the most depressing, discouraging, hopeless, serious diseases known to humankind, because everyone would throw their hands up in the air and say, well, look, we'll try some physical therapy, speech therapy. 3 months have gone by. We don't have much hope for you. Good luck. We hope you have someone in the family who can take care of you. If not, go to a nursing home. That was the depressing state of affairs a mere 30 years ago, and how far we have come in the last 25 years. Staggering, absolutely staggering in terms of clot busting drugs like TPA and tenecteplase that we talked about in other segments, in terms of mechanically pulling out clots that I've just referred to, and some of you are aware of it, stretching the window out to 24 hours, pulling out a big clot from the brain, restoring function that way early on, and then rehabilitation that we're talking about, intensive rehab, 6 months, a year, 6 years, 10 years after a stroke, and seeing improvement, stimulating nerves minimally invasively, adding on to rehab, showing improved recovery, and then, you know, the magical, almost seemingly magical solutions, the holy grail, maybe helping the brain to regenerate someday using various techniques. Perhaps it'll be stem cells. Perhaps it'll be something else that we'll come up with next week, next month, next year, showing great promise to help the brain regenerate. That's the new world of stroke. Once again, I can only say, if you have any symptoms of stroke, sudden weakness, sudden numbness on one side, sudden speech problems, or the face is sagging, or sudden trouble walking or trouble with your balance, call 911, get to the hospital immediately. With all the treatments we have available, the one truth that has remained since we established any treatment for stroke, time is brain. Time is brain. The sooner you get to the hospital, the sooner you can get treated, the more your brain can recover and bounce back after a stroke, meaning the better recovery you're going to have and have a functional, healthy, happy, productive life. And that's my speech.
Thank you, Dr. Libman. Thank you, Dr. Richard Libman. You always shine a light on give us so much information, and you're one of our favorites. We really love having you around with us again.
Keep saying that, and I'll come back anytime.
Thank you so much. Hopefully the people watching, if you've had a stroke, if you are, some years down the line, and kind of stuck in your therapy, this will give you some more hope to maybe encourage you to get out and get some more therapy, to start working again, to try to improve what you can. Again, find that donate button on the website on your screen, and every little bit helps. Thank you so much for staying with us, and Dr. Libman, thank you again.
My pleasure. All the best.